Hey everyone, welcome back to Cheddar. As Pfizer and Moderna roll out their coronavirus vaccines in the U.S., Microsoft has debuted a vaccine management platform for government and healthcare customers. The tech giant and its partners are working with customers to deploy vaccine management solutions that enable registration capabilities for patients and providers, phase scheduling for vaccinations, streamline reporting, and management dashboarding with analytics and forecasting. Joining us now to break all of this down and much more, Dr. David Rhew, who is the Chief Medical Officer and VP of Healthcare over at Microsoft. Great to have you here with us today, Doctor. Microsoft has collaborated with FedEx on inventory tracking technology earlier this year, we know. How is FedEx using your technology as it physically ships coronavirus vaccines across the U.S.?
Thanks, Brad, for having me. As we have shared earlier, much of what we've been focusing on is the enablement of and use of cloud to enable an efficient delivery of supplies. We started a process working with FedEx, one of our closer partners on this space, to help them in the process. And this occurred actually prior to COVID in the vaccination. But what we found is that this was the perfect delivery mechanism that allowed us to be able to help track also the vaccine in the process. So really nice that we were able to have it done just prior to the vaccination rollout.
You know, I wonder, particularly the rollout of this vaccine is far different than any that we've ever seen before. What pieces of artificial intelligence, modern day technology is involved in this distribution and will be carried through perhaps to the next type of vaccine that needs to be developed and distributed?
Well, as we think about the challenges, one of the challenges right now is that we want to vaccinate as many people as possible, as quickly as possible, and also in a prioritized manner. And to do that effectively, we're going to have to build new systems and new processes that go beyond what we currently have today. And those are going to require an ability for us to be able to engage individuals at a very personal level, to answer their questions. We've been looking at ways that the use of chatbot technology up front, which has already been used by many organizations across the globe to be able to provide that individualized recommendations, and then also enable them to register for the vaccination. That requires an AI-based technology that supports that process. But in the process of capturing the data relative to the vaccination, we also recognize that there is a need for us to understand who's getting vaccinated, who's not getting vaccinated. How do we identify those gaps or opportunities for improving that process?
These are new partnerships that much of the population is becoming acquainted with. The overlap between healthcare, the sector as we had traditionally known it, and some new tech-led renaissance that's also taking place at the same time. And I wonder, from your position as a chief medical officer, when we think about the fact that seemingly every cloud company now has a chief medical officer, we were just speaking with one from one of your competitors a few weeks back. What does that signal to you about the interest that traditional enterprise software companies have in a health system renaissance that is led by tech?
Well, just to get a little background on myself, I'm a physician. I actually am an infectious disease doctor trained during the AIDS era. And during that time, we saw a level of collaboration and coordination, and ultimately we were able to identify ways to address that. Today, we can accelerate that process with technology, and that's a really powerful thing that technology provides, an ability for us to be able to identify things earlier, accelerate the processes, and lead to more effective deliveries. And that's why you see so much of tech involved in these processes, because the goal is to try to find ways that we can save time and save lives.
Absolutely agree there. When we think about the role of the chief medical officer as well, and the interaction that is going to be more between some of not just the healthcare providers, but then the data that also gets captured along this broader process now, whether that be more customized in the experience that consumers are seeing and more targeted, which we hope that it is. When we think about the data at the end of the day, how does a chief medical officer or advisor, anybody, go back to a tech company and still advocate for privacy where absolutely necessary for the end consumer, the patient at the end of the day?
Well, technology has to be secure. It has to be private. It has to be transparent in terms of how the data are delivered. We've seen this being deployed in and very effectively within hospital settings, clinic settings, with electronic health records. We need to extend a lot of those learnings to the broader technology platforms that we see today that are used by consumers and that are now being deployed across the globe. There is a very extraordinary opportunity for us to be able to leverage what we already know and to be able to build upon it.
Certainly. You know, I was reading up on some of your work, and I found it particularly interesting, some of the insights that you shared in previous writings and about how the senior care part of the broader healthcare infrastructure is going to look different post-pandemic. And, you know, I wonder how you begin to think about post-pandemic, how the coronavirus in all phases, even into the vaccine distribution, is going to change senior care.
Yes, that's a great question. I think first off, we have to recognize that seniors are impacted so dramatically from a mortality perspective, from the fact that they're isolated. It exacerbates many of the issues that we see relative to that digital divide. Microsoft has been working closely with its partners globally, but more specifically even within the US, to look at topics such as addressing broadband access, digital literacy, healthcare literacy. These are all cornerstones of how we will help increase our ability to communicate more effectively with seniors. But also on the topic of seniors, we do need to understand usability is incredibly important. So all the things that we study around accessibility, ways that we can address issues when people have decreased hearing, vision, motor, those are all parts of what we look at when we try to make this more inclusive.
All right, Dr. David Rhew, the man whose occupation is the same as his initials, joining us here today, Chief Medical Officer and VP of Healthcare over at Microsoft. Thanks so much for the time. We appreciate it. Guys, coming up, the new